Good morning, viewers and listeners. I'm Godfrey Brooms, and I'm at the Ministry of Health to do the COVID-19 update for today, November 1, 2021. Soon we will be speaking with the Minister of Health, Dr. Frank Anthony, on the curfew hours being reduced, the issue of revaccination and booster shots, and whether or not persons will be permitted to enter government building even though they are awaiting their second dose of a COVID-19 vaccine.
The increase in cases will depend on people's attitude. And I think we've had more than a year and a half uh, where people get to understand the disease and the precautions that they need to take, which would be the masking, physical distancing, sanitizing. But in addition to those, what is also important is that people get fully vaccinated. So once you have more people becoming fully vaccinated, I think we'll see a drop in the cases. So all of us would have to work to make sure that we have more fully vaccinated people. Well, I think people had a long time to get themselves in order. And what we have noticed from the data is that a lot of people came, they took the first dose, and they didn't come back for the second dose. And a lot of time has elapsed between the first and second dose. Now, if you only have one dose of the vaccine, it's not going to be adequate for you to get full protection. And that is why this measure is necessary, so that people get both doses of the two-dose vaccine. And after your second dose, 14 days after, you're considered to be fully vaccinated. So it's important, at least, that those who have not yet get their second dose, that they go to one of the vaccination sites and get those second doses. It is very important. If not, they would not get the full benefits of the vaccination. There are countries where people have mixed their vaccines. And I guess for purposes of people coming into the country, and that is what I think we have reflected in the order, for purposes of people coming into the country, if they have mixed doses, then we'll accept them. But we ourselves are not encouraging people to mix the doses. So I think that should be clear. Revaccination is a little bit different. Revaccination meant that you have both doses, and you probably want to get another dose because of travel purposes. Medically, it's not necessary to be revaccinated. And in terms of booster doses is at this point, the WHO has not recommended booster doses. Booster doses in some countries have recommended it, but the WHO has not recommended it. The WHO's guidance has been that we focused on the unvaccinated rather than give a third dose or a fourth dose to someone who has been vaccinated. We have started some amount of training of our staff because this particular age group would require a vaccine that is 1/3 of the current dose that we are giving. And we have started that training. We are expecting that during this week we'll complete that training. So once full emergency use authorization is given in the United States, our FDA would then be able to license the vaccine for emergency use authorization here in Guyana. We expect that now that the US FDA has cleared it, that tomorrow and the next day, that the CDC would meet, would have discussions pertaining to this particular vaccine. And once they grant their approval, I think then we'll see an emergency use authorization for the Pfizer vaccine for that age category. That So one of the things, as you know, we have been using Pfizer um, for the low age group, that is 12 to 18. And we extended the use of the Pfizer vaccine to pregnant and breastfeeding women. As of this week, we are going to open up the use of the Pfizer to anyone who would like to get the Pfizer vaccine. So basically now anybody 12 years and above can access the Pfizer vaccine. For the first dose adult, we have completed 382,177 persons who have received the first dose of a COVID-19 vaccine. That's about 74.5% of our adult population. And we have currently 244,322 persons who would have received a second dose of the vaccine. That's about 47.6% of our adult population. In terms of the children, the 11 to 17 or 12 to 17, we have 27,401 persons who have received the first dose. That's 37.6% of our adult population. And second dose would be 18,271 persons. That's 25.1% of our children's population, or that age cohort.
And that's it for the COVID-19 update for today. For more information, you can visit the ministry's website at health.gov.gy and the DPI's website at dpi.gov.gy. Godfrey Brooms is saying goodbye for now.